Let me move on a little bit to the healthcare expenses on the neighbor island. A recent AARP Public Policy Institute study showed that more than 19,200 adults between the ages of 50 and 64 are without health insurance in Hawaii, or nearly 8% of that age group. How would you propose to meet the healthcare needs of older residents who are not yet eligible for Medicare and not covered through an employer-sponsored plan? Ms. Hirono?
When we fought so hard for the Affordable Care Act, we really wanted to encourage as many people as possible to be able to afford health care. And that is what the health exchanges are all about, to enable individuals who currently don't have any kind of coverage. They're in that gap group between their employment and Medicare. So I think the health exchanges, which the state of Hawaii is proceeding with, will enable individuals as well as small businesses and companies to go to those exchanges, to look for affordable care, and to be able to purchase it. Also, the Affordable Care Act gives money, gives some financial help to those who really are unable to afford health care. One of the keys, though, to the Affordable Care Act is that it requires everybody to be in the system, and that is how we're going to pay for it.
Skates?
You know, there's an old saying in medicine, before you know how to treat the patient, you have to diagnose the problem. So let's talk about what the problem is, especially on the neighbor islands. The problem is too few physicians with too great a level of stress on them to deliver services. And especially with lower income populations, the stress is especially on maintaining Medicare and Medicaid out there into needy communities. So as we look at what we need to do, especially on the neighbor islands, I would give you 4 or 5 specifics. First, I talked earlier about making the reimbursement formula for physicians in Hawaii fair. It is not right that we are getting some of the lowest reimbursements in the entire country with the highest cost of living. Second, I believe passionately in community health centers and worked tirelessly when I was in Congress to improve them. We need to continue that. Third, we obviously need to improve specific population deliverers, such as Native Hawaiian Health. The Native Hawaiian Health Care Act has been a fantastic program, and we need to continue that. I got a few more, but I'm out of time. Sorry.
Well, let me ask you this as a follow-up. The Affordable Care Act is prominently in the news now. The Supreme Court is considering it, and there is a possibility that the Supreme Court may strike it down if the Republican candidate, Mr. Romney, wins the presidency. He says the first act to do is to repeal the Affordable Care Act. What will you do in response to either of these scenarios involving the Affordable Care Act? Hirono?
Healthcare is a national issue. It represents 1/6 of our economy, and the growing cost of healthcare is a national concern. And that is why the Affordable Care Act was passed. Now, if the Supreme Court totally says that Congress had no business doing that, then I think that the concerns about healthcare, the ever-rising cost of healthcare, will devolve to the states. But first and foremost, I would look at that Supreme Court decision and figure out what can the federal government do to continue to support the healthcare needs of our people, because I do believe that healthcare is a right, it is not a privilege. And it's great for us in Hawaii that we have our prepaid healthcare law, which I fought very hard to make sure that there was an exemption for in the House version of the Affordable Care Act. That kind of legislation that the state of Hawaii had the foresight to pass over 35 years ago, I wish other states would adopt, but I don't think so. So we're going to need to work very hard to figure out how we're going to provide health care to the people of our country.
Mr. Case.
I agree with Maisie that affordable, available health care for all Americans is a right, not a privilege. It's something that government must do as a core function of government. Of course, we are concerned right now about whether the Affordable Care Act will continue on. And one thing that I know from law school is that once the Supreme Court rules, it rules. But also, as was earlier mentioned, you pick up the pieces. You go on. You're the legislature. You need to determine what you can do and provide the strong and effective leadership to get it done. We are, in fact, lucky in a way in Hawaii that we have such a revolutionary prepaid health care act. Imagine that you were in Mississippi if the Affordable Health Care Act was struck down. Pretty bad stuff. But we can probably surmise that some of the things about the Affordable Care Act can in fact continue. For example, healthcare exchanges, which increase competition among the private sector. The whole problem right now is that we've got the private sector becoming narrower and more powerful and monopolistic in its delivery of services and goods, and that has to finish.
Okay, now we come to the moment we've been waiting for. The candidates get to ask each other questions. In this round, we'll start with Mr. Case asking Ms. Hirono a question. Mr. Case.
Maisie, hello. Nice to be able to have a discussion with you.
We're having a lovely time.
Let's go out to lunch afterwards.
Why not? You pay.
You've got more money.
I'm enjoying this. Okay, go ahead.
That's not my question, by the way. Maisie, when I was in Congress, I advocated and supported the Social Security lockbox. The lockbox basically says, don't spend my Social Security money on non-Social Security purposes. And I hope and think you would agree with me that had we not spent our Social Security money on non-Social Security purposes, we would be in much better shape today than in fact we are, where we have spent all of the Social Security money. And so my question to you is this. Do you support the lockbox for Social Security monies going forward? And if you do, how are you going to balance the federal budget with the hundreds of billions of dollars that are going to be shortchanged to the federal treasury that it has been, unfortunately, I think, relying upon to balance its budget, which it has not been doing a very good job of?
Let me start this way. I think that Social Security, which did not add to our deficit, by the way, it is not the cause of our deficit, has been a self-sustaining system. And Congress has always replenished the funds that Social Security needs in order to keep that system going. So a lockbox idea I know was talked about by, I think, Al Gore and others, and once the money is in there, yes, I think that it ought to, be replenished, and we do have a tax reduction for employees because of our fiscal crisis, but what we did was then that led to less money going, as you know, into the Social Security Trust Fund, but that money was replenished through the general fund to keep the trust fund, Social Security Trust Fund, solvent. So there are many approaches that we can take, but the bottom line is, I want to make sure that Social Security, which is not just a program to manage, but a commitment that we need to keep, that we make those kinds of decisions that will keep it strong. And if the lockbox is the best way to do it, I have an open mind about it.
Okay, Mr. Hirono, you get to ask Mr. Case a question.
Ed?
Amazing.
When you were in Congress, many here in Hawaii were disappointed that you voted against the Medicare prescription drug benefit known as Medicare Part D. You not only voted against the Republican proposal for Medicare Part D, but you voted against the Democratic proposal too. Medicare Part D has provided millions of seniors with access to life-saving medicine and saved them millions of dollars. Do you have any regrets about voting against efforts to provide seniors with prescription drug coverage?
I don't have any regrets at all that Medicare Part D took place in a way that delivered prescription drug coverage to seniors. My objection at the time, and continues to be, that it was unaffordable over time. It was not paid for, either of those versions. And by the way, my recollection is that the Republican version was opposed by all Democrats, except for one, as I recall, who's no longer in Congress. And that the Democratic version that you referred to was a split vote among Democrats. The reason being that it was unaffordable over time. And it, in some ways, still is, because we are running a budget deficit now annually of $1.3 trillion. Now, had we taken a bill that provided prescription drug coverage to our seniors and paid for it in terms of offsetting revenues or expenses, as I believe that we needed to do then to balance our budget over time, I would have absolutely voted for it. But that was the reason why I voted against those two versions. They were unaffordable. We can still fix this. We can afford prescription drug coverage for seniors and balance our budget with some strong and direct leadership in Washington.
Thank you, Mr. Case. And we get to the point of the debate now where we have some questions from the audience. Here's a question. This question comes from a Kahului resident. My oldest sister lives on Molokai and has orthopedic problems. She has to fly to Honolulu at least once a month for treatment. That is difficult and expensive. What can you do about fixing the doctor shortage on the neighbor islands? Ms. Hirono?
I think it's really clear that rural areas, and that's most of the second district, rural areas. It's not just affecting us, it's rural areas all across the country. The doctors are, there aren't enough doctors. This is why I think it is really important to support the community health centers, which, by the way, is another part of the budget that the Republicans are attempting to cut dramatically. I think community health centers and providing a lot more support to primary care physicians and providing them with support such as, you know how much money that doctors usually owe when they come out of medical school. I think there are ways that we can incentivize doctors to go into high needs areas, places like Molokai, places like Lanai, and there are those kinds of approaches that I have supported. And I have a little bit of time left. Actually, Ed, when you voted against the Democratic proposal, there were only, for the Medicare Part D, there were only a small number of Democrats who voted against it.
Mr. Case?
And I think those Democrats that voted for that reason were more than small. And I think we were right to be concerned about the long-term fiscal stability of our country. As a matter of fact, I advocated at the time for PAYGO, which was to say that when you want to reduce taxes or raise a program here, it has to be budget neutral. Otherwise, you just keep on digging yourself into a hole. You later endorsed and supported PAYGO, so maybe I was just a little bit ahead of my time. In terms of doctors, let's diagnose the illness again. Why are doctors not serving our rural areas? And when I was in Congress, I did 172 talk stories around my district in Hana, in Namalehu, in Hanalei. I didn't do them in Honolulu. It wasn't part of my district. And by the way, Kahului, Hilo, Lihui, they are not the same level of healthcare delivery as Honolulu. But imagine that you're one step removed from that even, that you're in Pahala. Medicare reimbursements for physicians, lower paperwork out of Medicare for those physicians, community health centers, targeted support to specific communities. We can, in fact, turn this around for the rural areas that are underserved medically.